Hey guys, welcome to another video by That Dentist Guy. We've almost hit 1100 subscribers and I feel really happy about this. So let's begin with our session today. Today we'll be talking about the facial artery. Now the facial artery is a very special branch of the external carotid artery. It is also known as the external maxillary artery. Please keep in mind that the maxillary branch of the external carotid artery is also known as the internal maxillary artery. Okay, so as a new thing that you can remember, the facial artery is the external maxillary artery and the maxillary artery is actually the internal maxillary artery. Okay, so first off, we'll identify the course of the facial artery. Now, the moment you look at these pictures that I've kept here, you can understand that the facial artery is branching somewhere at the angle of the mandible. And after it branches out there, you see that the course of the facial artery is quite tortuous. Now, what this word tortuous means is it traverses in a very, distant fashion, as in it has to traverse and it is stretched out and it is folded towards itself rather than comparing with, say, the inferior alveolar artery, which runs a pretty straight course. Now that we have gotten that out of the way, we have to understand that the facial artery first starts at the inferior border of the mandible at the angle, and then from the medial side it has exited and come towards the inferior border on the lateral side. Now, after the inferior border on the lateral side, it has branched forwardly and on the superior direction. Before it moves into the superior direction, it has given off a few branches and then it has traversed its path lateral to the lips and then lateral to the nose and then reaches up to the angle of the eyes. Okay, so this part of how the facial artery travels is something very important for you to know. So just as a superior to inferior way to remember this, you can remember it as the facial artery. It begins at the nasolabial fold towards the medial canthus of the eye, which is here, right? And then it moves beneath the digastric and stylohyoid muscles and it will pass through the submandibular gland, which is somewhere here, right? Now the artery will then curve over the body of the mandible deep to the platysma, somewhere here, as the anterior-inferior angle of the masseter. Then it will ascend forward and upward across the cheek, as it's doing here. It terminates near the medial aspect of the eye in the region of the head. The facial artery runs parallel to the facial vein. Now, what you have to understand by this is the facial artery and facial vein actually traverse close to each other. So, damage to the facial artery could indicate a damage to the facial vein as well. Now, an important thing that you need to realize right now is that whenever there's a bleed, which could be from an artery or a vein in the angle of the neck region, it could either be the facial artery or the facial vein. Now, how do you differentiate this? Well, basically, an arterial blood spill or a cut in the artery, it will be bright red in color and it will spurt out. But if it is a damage to the facial vein, then it will just ooze out and it will be little darker in color. Okay, so now coming to the basic bread and butter of this video, the branches of the facial artery. Now that we have understood a brief idea of the course, let us understand the branches. Now, there are two big headings of facial artery. The first is the cervical part and then there's the facial part. Let's finish off the cervical part. Now, the cervical part of the facial artery consists of the ascending palatine, the tonsilla, the glandula and the submental. Now, what you need to understand is that there are muscular branches in both the cervical and the facial parts, but these are pretty common and they supply the muscles of the facial expression. Now, the ascending palatine artery, as you can see, is right here. It's highlighted here. Okay. Now, the ascending palatine artery supplies the auditory tube, which is here. Okay. And then the palatine tonsil, which you would have to imagine because this is an osteological picture. So it would be somewhere running on this side, somewhere here, because the maxilla is not very prominent in this picture. Okay, so the ascending palatine would be supplying the auditory tube, as I said, the palatine tonsil, which is a part of the Waldeus ring, the superior pharyngeal constrictor muscles, which is a part of the pharyngeal musculature system, and of course the soft palate, which covers the posterior part of your oral cavity. Now coming to the tonsillar branches, which I have highlighted in a black encirclement of sorts, I suppose. Its main purpose is to supply the palatine tonsil. Now you might recall that the ascending palatine also supplies the palatine tonsil. The fact is that both of these supply the palatine tonsil, and the palatine tonsil receives a sort of collateral circulation. If at all there is a cutoff from one of them, the other will be activated, since the tonsils are the lymphoid organs of the head and neck. Now coming to the submental artery. The submental artery is not quite highlighted here, but you have to imagine that the submental is the region here near the chin. So the submental artery will also supply the muscles close to this. So now what are the muscles that are there here? Obviously there is the mentalis. So the submental muscle group, and then of course the submental region where the skin is located. Okay. And now the other important structure that is present at the angle of the mandible and the inferior border are the salivary glands and a few lymph nodes. So what are the salivary glands here? There has to be the submandibular and the submental salivary glands. So those are supplied. And then of course the lymph nodes which are present here. So now that we have had an understanding of the cervical parts, now we'll move ahead with the facial part. Okay. Now as we go on with this, it is wiser for you to make a separate notes of the branches, which I will try to put pictures of on the community page. Please check it out. Now coming to the facial part. Now the facial part consists of about 4 and a group of muscular branches. Now the 4 parts are the inferior labial, the superior labial, the lateral nasal, and the angular artery. Now the inferior labial, as the name suggests, supplies the lower lip. Okay, but in other than this, it also supplies the labial glands, which are the minor salivary glands, which are located in the lower lip. Now another thing that you need to remember is that the mucoceles, which usually affects the minor salivary glands, are most commonly located in the lower lip. It could be either because of trauma or any other reasons that you could have damaged it. A mucocele is basically a cyst which can be of 2 types. There's a retention and an extravasation. I'll get into that on a later video. But I just gave you some clinical significance. Now then comes the superior labial artery. Now the superior labial artery of course supplies the upper lip, but it also supplies the nasal septum and the ala of the nose. Even though the moment you hear the lateral nasal branch, you would assume that it supplies the ala of the nose alone. It is not so. The lateral nasal branch again supplies the dorsum of the nose, and then of course a part of the ala of the nose. Then comes the angular artery. Now what is present at the angle of the eye? The lacrimal sac. So it supplies the lacrimal sac. What is present around the eye? The orbicularis oculis muscle. So it supplies those muscles as well. Now that we have had an understanding of the branches of the facial artery, let me tell you a little bit about the clinical significance of it. Okay. Now the most important thing is that the facial artery on palpation is a very useful landmark for an anesthetist. So what happens here is that the anesthetist usually palpates the facial artery. And how does he do this? Now when we studied the course of the facial artery, we found that the facial artery traverses in an anterior-inferior fashion to the lower border of the mandible. Now where is this exactly? Assume that there's a masseter muscle on the lateral surface of the mandible. The facial artery would travel anterior to this muscle, and then it would move upwards and distribute into its particular branches. What else is the clinical significance of the facial artery? It would be that the facial artery is sometimes involved in vascular diseases or atherosclerosis of the common carotid artery. Now, what does this do? It increases the risk of emboli shooting off, and hence strokes may occur. Now, the facial artery, as you know, supplies the muscles of the facial expression. So, this is the reason why a stroke sometimes affects the facial muscle activity. I hope you found this video interesting and something that you can have fun and study on a whole with. I hope we do well with our future videos. Thank you, guys.